disruptive approach and an approach that that can't really work unless we got the kids involved.
We talk about this a lot, but one of the main components of SNUG is a program that is parallel to law enforcement. So, you know, our participants that engage in the program, it's voluntary, and we don't work with law enforcement, but the idea is that by working with the highest risk, taking the public health approach, and working with, you know, those that might be at risk to be, you know, I think there's a fine line. We talk about folks are often victims and perpetrators of violence. You know, there was a young girl that we worked with who held her brother in her arms when he died. And so, you know, she then perpetrated gun violence, but why, right? You hold someone, you have that experience, you have trauma. So how do we address that as different than arrest and incarceration? Because where does that lead us? What happens when we take a different approach by building folks up and resourcing the community to then address this? So just sort of another